hope they hurry and come in. Come in.
Hi, Beth. Hi, cute little thing. I'm gonna need your name and date of birth, if you can.
Beth Tomlinson, February 24, 1977.
All right. And who is this cutie?
This is Chloe.
Hi, Chloe. Can I pet your dog?
Yeah.
Thanks.
You want
What kind of
her?
dog is she? No, actually, I'm working, so I want to get the dander on. But what kind of dog is she?
She's a Cocker Spaniel.
Oh, she's beautiful. All right, Chloe. So it looks like Dr. Veer came in and talked to you and gave you a diagnosis on your biopsy, your skin biopsy. So he did say that you had plaque psoriasis. So I'm Danielle, and I'm going to be your nurse today, and I'm just going to spend some time with you talking. We're going to talk about the plaque psoriasis diagnosis, and my goal is to help you understand what psoriasis is and how it is treated and how to care for your skin day to day. And to answer any questions you may have, please stop me at any time if something is unclear.
Okay, sounds great.
Okay, so psoriasis is a chronic autoimmune condition, which means your immune system is overactive, and overactive than it needs to be, and speeds up how quickly your skin cells grow. Normally, skin cells take about a month or 28 days in a cycle to go through the process, and with psoriasis, it takes about 3 to 4 days instead. So you'll notice a buildup of skin cells. That's called the plaque psoriasis. It's caused by an abnormal activation of T cells because of that skin cells build up on the surface, causing the thick red patches covering your skin. These patches are going to feel itchy, dry, sometimes sore and painful, unfortunately. And it runs in genetics. So does anyone in your family have it?
My dad, my mom's side, and my dad.
Okay, so it seems pretty common in your family then. Okay. So psoriasis is not contagious, and I'm sure you know this. You did nothing to cause it, and it tends to come and go. So it'll have flares and then quiet periods. And it's not caused by poor hygiene, so that's a great thing. Some people notice flares during times of stress, illness, skin injury, cold weather, and when certain medications are used. Does the explanation so far make sense to you?
Okay, sounds great.
Does everything make sense so far?
Yeah.
Perfect. What have you noticed about your own symptoms?
I've noticed flaky and itchy on my scalp and elbows mainly.
All right. Have you had any joint pain or tenderness?
No joint pain.
Perfect. That's great news. Have you noticed anything that tends to cause it to become worsened?
Stress has definitely caused more irritation.
All right. Well, I want to apologize for the noise. It sounds like it's bringing your kid to work today and there's lots of kids going on in the office. So if you hear any noise, just kind of ignore it, but we're going to keep going. So there's different types of psoriasis. The most common is the plaque psoriasis, which Dr. Rivera did say that's what he was going to diagnose you with. And that's, again, those itchy, scaly patches, raised patches. They often appear on your elbows, knees, scalp, and lower back. And it sounds like from what I've seen on your paperwork, you're experiencing it kind of on your elbows and your scalp. And you may also experience with that some nail changes like pitting or thickening of the nails. You might have joint pain or stiffness, especially in the mornings. You could which would be a sign of the psoriatic arthritis. So if you do notice that, give us a call. If you have any new joint pain, swelling, or stiffness, especially in the morning, you'll want to let our facility know right away. If you have any other worsening symptoms, also a great time to let us know. So treatment options. While there is no cure for psoriasis, there are many effective treatments that help control symptoms and reduce flares. Your provider, Dr. Rivera, recommended some creams and some injections for you. So he recommended the Clobex, which is a 0.5% topical cream twice daily. And then Tremfya shots. So we're going to do one of those today, and then we're going to do another in 4 weeks and another in 8 weeks. So I know you mentioned wanting to try sun tanning as well. So that's going to reduce, the phototherapy will reduce inflammation and slow skin growth. Let's see, want to use your medications exactly as prescribed. Avoid stopping treatment suddenly unless instructed by Dr. Rivera. Be patient. Some treatments take several weeks to show results. Do you have any concerns about using any of these medications?
No.
All right. So, daily skincare, you're going to want to manage your daily skincare routine to help your psoriasis. Some helpful tips. You want to moisturize daily, especially after bathing. Use lukewarm water, not hot. You don't want to cause, the hot water will cause your skin pores and skin cells to open and allow moisture to come out, and we want to keep as much moisture in as possible. So with that, you'll want to choose gentle fragrance-free soaps. You'll want to use like a Original Dove, something that's moisturizing, something that doesn't have a lot of scents to it, as it could irritate the psoriasis. So you're going to want to keep your nails trimmed and avoid scratching and picking at the patches, as it can cause irritation and cuts to the psoriasis in the skin, and that would cause bacteria to enter and then cause an infection, and we don't want that. So lifestyle habits matter. You don't want to try to manage your stress, which can cause flare-ups. You want to try to do anything you can to relax, maybe yoga or any other kind of breathing techniques. You'll want to exercise and be mindful of stress. Avoid smoking, limited alcohol use, as these can really worsen your symptoms, especially being on the medications as well sometimes. Maintain a healthy diet and stay very well hydrated. Hydration is the big key here. And then cold, dry air can also make your psoriasis worse. So use a humidifier. Some people find a little bit of relief in humidifiers at home. All right, so your emotional well-being and support. Living with psoriasis can be emotionally challenging. Some people feel frustrated, embarrassed, stressed about how their skin looks and feels. Those feelings are completely understandable and totally valid. If psoriasis ever affects your mood, confidence, or daily life, please allow us the opportunity to help. Support groups, counseling, and educational resources can be very helpful, and you are not alone in your journey. Help is available. All right, before we finish, I'd like to make sure I explain things clearly. Can you tell me in your own words what psoriasis is?
Psoriasis is where skin cells go through where life cycles in 3 to 4 days rather than normal 28 days, causing a buildup of skin cells.
All right, that sounds like you're getting a great understanding. 1 or 2 things that can help manage the psoriasis at home for you.
I'm going to try sun tanning along with cream on my affected areas to help relieve symptoms and come back periodically as recommended by Dr. Rivera in rejection.
All right. So the injections, we're going to do 1 today as we discussed. Sounds like you're doing the right thing by learning about your condition and staying involved in your care. If you have any questions, please let us know. If you have any worsening symptoms or new symptoms, joint pain, or medication concerns, please contact us, as we'd love to help you out with that. Do you have any questions or concerns you'd like to talk about before we wrap things up today?
Pets cause irritation into
will pet cause irritation to the psoriasis? So there's no studies that say pet dander or anything will cause irritation, but we often recommend trying to be careful with that. So making sure you're washing your hands and stuff, and trying to, if it does cause irritation to you, limiting the exposure. Any other questions?
No.
Okay. All right. Well, thank you for your time today. We're here to support you in every step of the way. So please let us know if there's anything we can do. I'm going to give you your packets here as I head out to get the shot ready for you. So I'll be back in just a minute, and there's your informational packets on your medications and just what psoriasis is. And if you need any clarification, you can call and ask us anytime. All right, I'll be right back in with the shot.
I hope this will take forever. I'm starving.
All right, ma'am, do you want to lay on back for me? All right, and we're just gonna give you this shot today with this dirty old needle. All right, did that hurt?
No.
Okay, perfect. All right, and